Ideally, we are starting behavior therapy sooner rather than later. Even if you're investigating physical health concerns, even if you're starting behavior medication and waiting the several weeks for it to start taking effect, even if you are getting ready to move or going on vacation or having a big life change and thinking about maybe getting started when you get back. Of course, life is less than ideal sometimes, and we don't want perfectionism to stand in the way of progress. But if you have the capacity, if you have the resources, and the question is simply, when should I ideally start behavior therapy? The answer is sooner rather than later. And I think the reason that we ask this question in the first place is based on a misconception about what behavior therapy is. We think my dog is going to be learning skills and working with their trigger and doing work. And so I should start that after we've created the ideal conditions. But that is not all of what behavior therapy is. That is a small part of what behavior therapy is. Behavior therapy can set you up to make sure that while you're waiting for these other factors, things are not getting worse, things are not unsafe, that we are optimizing enrichment, which can include things like collecting data to investigate physical health issues or optimizing sleep. It involves learning how to handle those stressful moments in a way that best benefits the dog. It involves the human piece of things and our behaviors and our understanding. It addresses our relationship with the dog. It addresses how we support them through stressful moments. It often involves clearing up a lot of misconceptions. It involves collaboratively troubleshooting the day-to-day in an attempt to learn in the broad picture how to better support the dog in the long run. And so it's very, very uncommon that I tell clients we should take a pause here and reconvene after X, because we would just be delaying support for the dog.